In today's video, we're going to talk about a condition that creates chest pain that can often mimic a heart attack, but what's really going on and what to do about it. I'm Dr. Rodney White with Chiropractic, and thanks for joining us. So at least once a week in one of our offices, we'll have someone come in with chest pain that maybe they've already had it ruled out that it's not a heart attack, or maybe not yet, but in their minds they're thinking, am I having a heart attack because the pain is so sharp? And quite often they're suffering from a condition called costochondritis. This basically means there's inflammation right around where the rib attaches to the cartilage and the sternum here. And it can be very painful. It can be a very sharp pain just because of how inflamed the rib gets and all the nerves involved. And it very much can mimic a heart attack. If you are suffering from this, the good news is if you feel up your sternum and you find that point that's really sore and you can reproduce the pain, you're probably not having a heart attack, and it probably is costochondritis due to mechanical issues in your spine and rib cage. So sometimes this condition will just go away on its own, but that can take weeks or months, and it can be very painful. Every movement, it can wake people up, deep breaths hurt, and it just seems like it's never going away for a lot of people. The normal medical treatment would be to prescribe some anti-inflammatories or pain drugs, but like any other condition, that's purely masking the problem, putting a Band-Aid on it. There are times you need to do that. If you're in so much pain you can't function, or I certainly couldn't fault anyone for taking some kind of medication to try and calm that down, but just know that that's not getting to the cause of the problem, it's just a Band-Aid. So this is where chiropractic might be able to help. What we do when we adjust someone is restore normal movement to the spine, and the rib joints are part of that. We also affect the nerve supply, and we help the brain have better control over everything. So if we can get better movement through our rib cage and spine, and now we can take a breath and our ribs move as we breathe, and they're not now pinching and catching and irritating, and the inflammation goes away, everything's going to calm down, because there's always a lot of muscle spasm and nerve irritation and all these other things going on. So if you are suffering from this pain, obviously if you're at any risk of a heart attack, get that checked and ruled out first. But once you know it's not that, a chiropractor might be the best place for you to stop by and see if they can help. These generally resolve reasonably quickly. They don't take anywhere near as long as something like a disc injury or anything like that. So that might be the simple answer for you. So next time you think you're having a heart attack, if you can feel pain and a lump right on the edge of the sternum here, and it is the same pain that you're getting, while you're waiting for the heart attack to be ruled out, go to your chiropractor and see if an adjustment might just be the answer for you. If you have any other questions about this condition, just reach out to us at sapchiro.com. We'd be happy to meet you and assess you and see if it is a costochondritis issue that we can help with, and if it's not, we'll make sure you get referred to the right place. Thanks for watching, and we'll see you next time.